welcome to our YouTube channel. Welcome to our first YouTube video ever. I am Terry and this is my partner, Petrina. Delving straight into it, we are going to talk about gonorrhea, as we said, but we should remember that gonorrhea is an STD, is an STI, but they are basically the same thing. So STI is sexually transmitted infections, STD is sexually transmitted diseases. When we talk about STIs, they are basically any infection that is transmitted through sexual contact caused by either a bacteria, a parasite, or a virus. Yeah, so keep in mind, any infection that is passed through sexual contact. It could be vaginal sexual contact, it could be anal, it could be oral. So you can get STDs from any of these three sources. Any intimate contact that is had. Yes. So we have in terms of STDs, we have herpes.
Yeah, we have chlamydia.
True.
We have gonorrhea,
which we are going to talk about. HIV is also an STD. HPV, the human papilloma virus. Yes. We have public lice. That's also an STD. Syphilis is an STD.
Trichomoniasis. Yes, trichomoniasis.
We'll talk about that one. We'll talk about that one. So, what causes sexually transmitted diseases?
Okay, for sexually transmitted diseases, they are caused by bacteria, viruses, or parasites. So it could be any. Yeah, you just say it could be any of these.
So anybody can actually be affected by STIs. STI doesn't know your age. STI doesn't know your female.
Whether you are fat, whether you are slim, whether you are tall, whether you are rich or poor.
STI don't know you. STI can affect anybody. No boundaries. STI doesn't respect boundaries. So you can actually be pregnant and have an STI. Which could cause certain serious problems for your babies.
If not care,
And then there are certain symptoms that could actually show that you have an STD. You don't just stand up and then you conclude that you have an STD. You need to see certain signs, certain symptoms to show that you have an STD. Before we move on, have you had a gonorrhea before?
No, I'm not sure.
This question is supposed to go, we are just supposed to answer yes, no. You just say,
sure. Okay, what are you thinking?
Do you have it? Yes.
No, I haven't.
You haven't got it?
I haven't.
Okay. So, she hasn't gotten gonorrhea yet.
So, really?
She hasn't gotten gonorrhea. Okay,
have you?
No.
But any case of STDs?
Any case of no case of STD, no case of sexually transmitted, no case of any of that. So yeah. So we were talking about the symptoms before I had to know. I had to know. So some STDs do not actually cause symptoms. Some of them do not show symptoms at all. Some of it will show symptoms. So it's possible that you actually have an STD
and then no symptoms.
And then no show symptoms.
It actually depends on the immune system, you know.
True. So your immune system is also a factor of it. So I could have an STD, my immune system is probably strong, and then I wouldn't know, and then I'll be passing it on.
Yeah, you'll be a carrier of it, so you'll be passing it on to other people. True. So it could be that. And let's talk about the symptoms and then the signs. Yeah,
so under the symptoms, so if you are talking about the men, men STD symptoms are different from women STD symptoms. So if we talk about men, you can have an unusual discharge from the penis. It could be cloudy, it could be brownish. You have that cloudy, low-key discharge. You also have sores or whites on the genital area on your penis. You could have sores on for the men.
Sores at the tip of the penis.
You can also have frequent or painful urination.
Itching.
Yeah, so as a sore is there, as a sore somewhere there, you still could have some itching around there, blisters on there. You could also have blisters on your mouth. That will show that you have an STD.
And then for the female, abnormal vaginal odor, like that foul scent under the.
Females could also have discharges. Also have discharges over there. Itching too. You could also have anal itching, abdominal pain, and then fever. It's just a general symptom of
fever is also part of
STD. So how is STD diagnosed? How are STDs diagnosed?
Okay, you could go to the hospital for a test. So you actually go, they run a test on you, and then if you have it, it will show. If it's positive, you will know. If it's negative, the doctor will actually explain things to you.
So it's actually important to get tested, because as we mentioned earlier on, you could have the STD and not show symptoms, not know that you actually have it.
Yes.
That's why it's important to get tested regularly once you are sexually active.
For me, I was thinking if you are really sexually active, it should be maybe every quarter of the year. Yes. So every 4 months or something, you get checked or something.
So you could actually do STDs, a physical exam, or through microscopic examination of some of the blisters that you get there, or the blisters on your genitals. You also have a fluid that is going to be swapped from your throat. You can have fluid that are going to be swapped from the vagina, from the penis, from the anus. So we also have blood tests done to diagnose.
So the test is not that difficult. No. It's nothing to be alarmed. No.
It's actually easy, but what the problem actually is the fear that is associated with it. You have to have an STD test, and then you are thinking, do I have the STD? Do I not have the STD? What if I have the STD? All of that is actually part of it. So, when you are treating STDs, we use antibiotics.
Antibiotics.
To treat STD. So the antibiotics actually are used to treat the bacteria or the parasites, and then there is no cure for STDs that are caused by viruses. Please, let's remember that there's no STD that is having a cure from virus. Yes, but then there are certain medicines that I'm talking about, virus causing STDs. We have medicines that could bring it down, lower the risk of spreading the infection, like HIV.
Actually, you can live a normal life.
True.
As far as you're taking very good care of yourself, you could live a normal life.
So when we are talking about STDs, there is prevention of STDs. The most common prevention for STD is the use of latest condoms. So this doesn't eliminate the risk of you getting an STD, but it just reduces it to a certain level. But then the sure way to know that you're not going to get an STD, the sure way to not get any STD is abstinence.
Total abstinence.
No sexual contact. No sexual contact. No vaginal sexual contact. No anal sexual contact. No oral sexual contact. If your boyfriend says he's allergic to latest
condoms, that matter.
Your boyfriend is allergic to latest condoms. You use polyurethane condoms. So he says you can't use condoms. The other options that you can consider. So don't just sit down.
Say that he wants a raw. Which raw? Nobody
STD doesn't know anybody. So it could also happen that your girlfriend could also say she's allergic to latest condoms. Again, you could use polyurethane condoms to prevent or lower the risk of an STD. How is sexually transmitted diseases transmitted? How do you share it?
Okay. Actually, we said when we began, we actually talked about anal sex, oral, and all those kinds of things. So let's take
what happens during the gonorrhea test. I need to know.
Okay. For the gonorrhea test, if you're a woman, a sample may be taken from your cervix, with a soft brush or a spatula to collect some samples from your cervix, and
with the men, it's actually a swab may be done from the tip of your urethra. And in both men and women, you also take samples from the rectum.
Okay.
You take samples from the rectum. You also take samples from your mouth, from your trachea, because as we mentioned earlier on, the gonorrhea bacteria thrives in moist
places.
So you know the three forms, the three ways in which you can actually contract the STIs. So oral, anal, vaginal. So all of these are places where you can actually have the gonorrhea test sample taken from. Can sexually transmitted diseases be prevented?
Yeah, they could.
How?
By using condoms or total abstinence.
So the sure way is the total abstinence. The sure way of not getting STDs is total abstinence. No anal sex, no oral sex, no vaginal sex. So And then the issue of boyfriend being allergic to condoms.
Yeah,
latest condoms. So if your boyfriend is allergic to latest condoms, please, there's another option. You can use polyurethane condoms. So no excuse. No excuse.
No excuse.
You actually have vaccines that could prevent certain STIs like hepatitis B. We also have vaccines for HPV. So you should also get your vaccines. It's important. So talking about what we are discussing today, gonorrhea. I don't like the way I'm saying gonorrhea.
Oh, gonorrhea.
I don't like the way I'm saying it. Anyways, gonorrhea. What is gonorrhea?
Gonorrhea is a sexually transmitted disease. We all know that. And then it's mostly found in young adults. I wouldn't say young adults per se. Like anyone who is sexually active. It's found in anyone who is sexually active.
Before it was common among young adults, but right now this is on the rise among older adults also. So like we said earlier on, again, gonorrhea doesn't know boundaries, doesn't know your age, doesn't know who you are. You could get any STDs, you could get gonorrhea also. And talking about mothers who have certain STDs. So for example, if a mother has an STD, she could actually pass it on to her baby during delivery. So to prevent that, you could actually get tested if you are pregnant and you think you have gonorrhea. You get tested, and then you see your healthcare provider who would actually provide certain antibiotics for you that would not affect or harm your baby in any way. Your baby will be safe, and then the STI, the gonorrhea, will be
out of the way. And then moreover, you should know that gonorrhea is caused by bacteria. Yeah, it's caused by bacteria. So that is the reason why antibiotics are given to take care of the gonorrhea.
Yes. So we mentioned earlier on, gonorrhea doesn't show symptoms. It does not always show symptoms.
At times it does show symptoms.
Gonorrhea doesn't always show symptoms. At times you get symptoms, at times you won't get symptoms. So women, the symptoms that we mentioned earlier on, painful urination, an unusual discharge down there, blisters on the mouth, around the genital, sores, anal itching. You could also have problems with your prostate and your testicles. So it could be pain. You could also have in the women
vagina odor.
Fun fact. Okay, it's not fun fact. It's not a fun fact. But facts about women who contract gonorrhea is they actually show mild symptoms. So you could actually, the ladies could actually see the symptom of the gonorrhea, but it will be mild, and then they'll be like, oh, they could actually attribute it to say, oh, it's probably some vaginal infection, or related to something else other than the gonorrhea that you're actually having. So the reason why it's important to get tested. So if the man doesn't get tested and he has gonorrhea, he's not showing symptoms, the gonorrhea being in his system for a long while could cause certain disadvantages for him, cause problems with his fertility. It's the same with the ladies also. So the same with the lady also. It could also cause pelvic inflammatory diseases, which could lead to infertility problems in the lady also. So you could also have ectopic pregnancy.
So like, I actually wanted to say that if you go to the hospital and then you are being tested, and when the result comes out, the doctor says, oh my dear, you have your test result shows that it's positive, you shouldn't really be alarmed, but please, you should contact any of your sexual partners. If there are 2, there are 3, I don't know, any amount, but then please do contact them and then make sure they are also tested. And then any medication that has been given, they should take it, so that at least it will clear everything.
So you remember that the bacteria grows in warm, wet areas in the body. So the urethra that carries the urine or the semen out of the body, in the women it will be found in the fallopian tube, it will be found in your uterus, it will be found in your cervix. It can actually also be found in your eyes. So depending on how the contact is made, it will actually be found in your eyes. So it's important that you talk to your healthcare provider. It's important that you talk to them. They are there for you. Just like how we are here for you. Talk to them about your problems, what you are experiencing, and then you'll be able to get the right medications for you, the right antibiotics that will work for you. So because of the current strains of the bacteria that are moving, it's important that when you are giving your medication, you take it regularly. If you don't take it as prescribed, your body could actually draw resistance on the bacteria. Then you'll have to really go for a different treatment.
And those with allergies, those who are allergic to some drugs, please, you have to make sure the doctor is aware of such stuff before, even after after he's tested and everything. If you are allergic to a drug or something, you tell the doctor, and then he knows which drug will be more effective for you or something.
So Petrina is more likely to develop gonorrhea if she has multiple sex partners. If she has a partner with a past or a current history of any STIs, if she doesn't use a condom during sex, and if she abuses alcohol or illegal substances. Now that part, you abuse alcohol or illegal substances causing gonorrhea is in the sense that when you take alcohol, you take any illegal substances like narcotics, you do certain hard drugs, it impairs your thinking ability. So what you wouldn't do if you are sober, because of the drugs, because of the alcohol, you are now doing them, which would lead to the gonorrhea. That doesn't care who you are. Talk about the gonorrhea test.
Okay, so the gonorrhea test looks for the presence of gonorrhea bacteria in your body. So actually in women, he actually said it causes pelvic inflammatory. So it causes pelvic inflammatory diseases, ectopic pregnancy, and everything. Those kind of things in women. Okay, most STDs and STIs are asymptomatic. And to ensure your sexual health, make sure to get regular checkups, like back-to-back checkups. So not just 1 year then you go and check, 1 year then check. Back-to-back. Maybe every 4 months or maybe every 3 months, something like that. Because I know that maybe if you are sexually active, that is how you should check it. Because if you are sexually active and then you have to wait for a whole year before you go and check, my dear, what if it's eating up? I don't know.
You're putting yourself at risk and then your partner's at risk. But then you actually know that the CDC recommends testing based on certain categories. So for men, heterosexual men, the CDC recommends yearly testing.
That is
who are sexually active.
Sexually active. How can
I'm quoting. CDC says heterosexual men need to do a yearly testing if they are sexually active.
But for me, actually, I think if you are sexually active,
once you are sexually active, you think you have been exposed to the virus one way or the other, you've been exposed to a bacteria or the parasite one way or the other, it's important that you test regularly. So we are going to do a recap. We're going to do a recap on everything that we said so far. A recap on gonorrhea. Gonorrhea is a bacterial infection that can affect the genitals. And it appears within 10 days of exposure. That is, if you are going to show symptoms, it appears within 10 days of exposure. And could be found in your anus, your throat, your cervix, your fallopian tube, and there is any sexual contact. Through that place, you will actually have the bacteria found over there.
The symptoms.
And another thing too is when you have gonorrhea, more times when you have gonorrhea, chlamydia is here. And the thing is, they actually have the same symptoms, or they have similar symptoms. So when you go to test for your gonorrhea and then the healthcare provider decides that you're going to do a chlamydia test, don't be offended, do not be worried. It's just to be on the safe side, because most often when you have gonorrhea, chlamydia is also behind it. The symptoms.
So for the symptoms in men, it includes white or bloody discharge from the penis, burning sensations with peeing, when you're going to pee and then you feel a sharp pain. Sharp pain, that one. And then sores and blisters around your mouth and then around the penis. And then if you feel that this is very itchy, it could be
a cause for concern.
And then with the woman, vagina odor, and then we also have
cloudy discharge. The vagina also. Abnormal menstruation is also a part of it. There's itching, there's painful bowel movements, there's anal
and then abdominal pain. It can also be gonorrhea. Abdominal pain.
So gonorrhea, for the last time, it's spread through sexual contact from the vagina, the penis, the mouth, or the anus. And you do not have to ejaculate to get or to give gonorrhea. Sexual contact happens, gonorrhea can happen.
And then oral sex doesn't prevent you from having any STD.
So you can't depend on oral sex saying, oh, it was just oral sex. No, there's cause for concern. So this is the end of our gonorrhea episode, the first series under STDs. The first video for FND health chapter. If you're still here with us, please remember hit that like button. Remember to hit that like button. Remember to subscribe if you haven't subscribed yet. Remember to subscribe and
leave a message in the comment section.
Yes.
Any question, any information you think we will need, please leave it down there.
Leave it down. Remember that we are here for you, and it's your host.
Yeah.
Terry
And Petrina.
And Petrina.
We love you.
See you another time.